Your skin is more than a protective barrier. In some cases, it may reflect changes in underlying metabolic processes. With many diabetes cases still going undiagnosed, early indicators may sometimes appear on the skin before symptoms are recognized. Subtle shifts in color or texture may reflect underlying changes. Learning to identify these signs early may help you take action sooner and reduce long-term risk. One skin change worth monitoring is the appearance of skin tags, or acrochordons. These small, soft growths often develop on the eyelids, neck, underarms, or groin. While typically benign, some studies suggest a possible association between multiple skin tags and insulin resistance or impaired glucose metabolism. A higher prevalence has been observed in individuals with metabolic dysfunction. Skin tags alone are not diagnostic, but a noticeable increase or clustering may warrant further evaluation to better understand your metabolic health and potential risks. Beyond monitoring for skin tags, it is also important to examine areas such as the neck, underarms, and groin for signs of acanthosis nigricans. This condition appears as darkened patches of skin with a thickened, velvety texture. It is commonly associated with insulin resistance, suggesting that the body may be struggling to regulate glucose effectively. While not a diagnosis on its own, its presence may indicate underlying metabolic concerns. In some cases, gradual weight loss and improved metabolic control may help reduce these visible skin changes over time. Changes in skin texture should also prompt a closer look at the shins for diabetic dermopathy, often referred to as shin spots. These typically appear as light brown, slightly scaly patches with a round or oval shape. They are usually painless and non-itchy, but may be associated with changes in small blood vessels linked to diabetes. While not harmful on their own, their presence can reflect underlying metabolic imbalance. If you notice similar spots, consider discussing them with a healthcare professional for appropriate evaluation. Understanding the link between these visible skin changes and internal health highlights the importance of lifestyle as a key area for intervention. In individuals with overweight or obesity, gradual weight loss may support improvements in these markers over time. Addressing insulin resistance through better glucose regulation and a balanced diet is often a central focus in managing these conditions. By prioritizing metabolic health, the body may begin to recover, and some of these persistent skin changes can become less noticeable or gradually fade with sustained improvements. As you work to improve metabolic health, it is also important to watch for eruptive xanthomas. These appear as clusters of small, firm, yellowish bumps, often with a reddish halo. They are commonly found on the buttocks, legs, arms, or the backs of the hands. This condition is often associated with significantly elevated triglyceride levels and may be linked to poorly controlled diabetes. While concerning, these lesions can improve or resolve when underlying metabolic factors are addressed through appropriate medical care and sustained lifestyle changes. Monitoring triglyceride levels and glucose remains important, but it is also helpful to watch for a condition known as granuloma annulare. These skin changes often appear as firm bumps or patches that may be pink, red, or skin-colored. They frequently form ring-shaped patterns with raised borders, commonly affecting the fingers, ears, or torso. Although they can resemble minor allergic reactions, some cases have been associated with underlying metabolic concerns. Because this condition may persist over time, consulting a healthcare professional can help ensure accurate diagnosis and appropriate management. Moving beyond ring-shaped patterns, it is important to distinguish common pimples from a more serious condition known as necrobiosis lipoidica. These lesions may begin as small reddish bumps, but can gradually expand into larger areas of firm, thickened skin. Over time, they may develop a smooth, shiny surface with visible blood vessels showing shades of yellow, red, or brown. In some cases, the skin can become fragile and prone to ulceration. Because of potential complications, ongoing medical evaluation is recommended to support proper management and reduce associated risks. A less common but important sign to recognize is bullosis diabeticorum, also known as diabetic blisters. These fluid-filled lesions often appear on the hands, feet, or forearms and may resemble burn-related injuries. Unlike typical burns, they are usually painless and occur without surrounding redness. Although they can resolve on their own, they may increase the risk of secondary infection. If these blisters appear, seeking medical guidance is recommended, along with ensuring that blood glucose levels are properly managed to support safe healing and recovery. Changes in hand flexibility can also signal a condition known as digital sclerosis. This involves thickened, tight, and sometimes waxy skin developing on the back of the hands. As the skin stiffens, finger movement may become limited and uncomfortable over time. Some individuals describe unusual sensations within the fingertips. These changes can also affect areas such as the knees or elbows. If you notice increasing stiffness or skin tightening, it may be helpful to evaluate your blood glucose levels and consult a healthcare professional for further assessment and appropriate management. Early recognition and timely intervention remain essential for protecting long-term health. The skin changes discussed here may offer important clues that allow action before more serious complications develop. Identifying these signs early can support collaboration with a healthcare professional, which may help reduce the risk of developing conditions such as cardiovascular disease, stroke, kidney impairment, or vision problems. If you notice any of these findings, seeking medical advice is strongly recommended. A proactive approach can help maintain better metabolic control and support overall health outcomes over time. Thank you for watching. This content is for educational purposes only. If this changed how you think about nutrition, don't forget to like and subscribe for more science-based insights.